We head into the month of March with a great deal of promise on the pandemic front. Cases and hospitalizations keep dropping, as has guidance on masks and other measures. But the Michigan Department of Health and Human Services is urging us to proceed mindfully. Let's talk about that with the state's Chief Medical Officer, Dr. Natasha Bagdasarian. Dr. Bagdasarian, good to have you back on the program again. I know you're getting this question a lot. Is the pandemic over? Will we ever get to a point where we can talk like that, or are we just always going to be talking about phases of it and where we are on those phases?
Well, the pandemic will end, but what I want to communicate to the public is that it's not a straight line to the finish. It's not that things are going to just keep getting better and better, and one day we won't have to think about COVID anymore. What we're actually thinking about is that as we look at COVID, things will become more predictable. That means that we will see surges in all likelihood, but those surges will become linked to either changes in the weather. So it's possible to see a surge around wintertime when the weather gets cold. It's possible we may see another surge when schools reopen. And I also anticipate seeing surges related to new variants of concern.
Yeah.
So we'll continue to see increases in cases, but we're going to look at predicting them in a better way so that the public can know what's coming up and what we're anticipating. But we will see things improving and then potentially getting a little bit worse and then getting better and then getting a little bit worse again. And so what we're trying to communicate out is that we expect to see times of higher risk and times of lower risk. And everyone has been on really high alert for the last 2 years. So what we want to do is to be able to communicate that this is a relatively lower risk time right now after our Omicron surge.
Yeah.
But that things may change.
It's interesting because we found ourselves last week, we had a couple of days where we were around 1,000 cases a day, which is so much lower than we were, and yet that means 1,000 people are still coming down with COVID each of those days. That's still a lot, isn't it?
It's still a lot, but we have to keep in mind the metrics don't mean the same thing they meant a year ago or 2 years ago. And it's simply because we have new tools. We have tools that weren't available at the beginning of the pandemic. And there may still be those same numbers of cases, but if they're not causing severe outcomes and death, if they're not overwhelming the healthcare system, and if our schools and other infrastructure is able to remain open, then we are okay.
So the department has kind of created this cyclical graphic for people to understand where we are either in a pre-surge, the surge itself, or post-surge. And you kind of alluded to this earlier. It's easy to tell when we're in a surge, I guess, and we can understand a little bit about what a post-surge feels like. It's so important, and how much better have we gotten at recognizing what pre-surge looks like? That would seem to me to be the most important component of the cycle.
It certainly is. It's that readiness component and really telling the public what's coming next. We had a practice run at this with Omicron. And what we saw was we saw what Omicron was doing across the world and across the country. And so we looked at modeling, and that modeling was able to tell us when we expected to see a peak of cases, how long we expected that to last, and when things would return back to around baseline levels. And our modeling was right on. So I can't say that we will be able to predict future surges with 100% accuracy, but we can think of this as a weather report where we can at least let the public know what we're anticipating in the next few weeks to months.
Yeah. One of the tools that you mentioned that we now have is, yes, this widely available vaccine and boosters. Do you think we've got a decent understanding then of who will need boosters and how often we'll need them going forward, and how often will those boosters need to be modified for these new variants?
So we have to keep in mind that the virus has only been with us for 2 years, and the vaccine has only been with us for just over a year.
Right.
So we don't have that long-term data. We will get a better understanding as time goes on, and that's one of the things that we're following very closely.
That's a little daunting. The part of it, you're right. I mean, there's still so much about this that we're having to learn. But if you had to look now over the way that we responded, what would you say are the takeaways of what we did not do very well and need to improve the next time?
Well, this is really about engaging with the public and making sure that we have the public trust. So I think having conversations like this, that's one way to really engage and make sure that we're telling people what we would like them to know. But then we also need to have people taking our public health recommendations. So I think that if we can improve our communications and really engage with the public and get that level of public trust back, my hope is that for the next surge that we see, we can signal early when we expect to see it coming, and that people will really heed our recommendations, whether they're recommendations around boosters or masking or our other tools. So I think having conversations like this today is very important.
I think it was Crane's Detroit Business that had a piece this past week that I thought was really interesting, and that was a lot of, especially smaller hospital systems, smaller healthcare facilities around the state may have a really difficult time recovering from what it took to get us through, at least to this point of the pandemic. Do you have any long-term concerns about healthcare across the state, given what so many hospitals have been through?
It'll certainly take time. I think that not only were the hospitals inundated with COVID-19 cases when we saw that Delta surge with the Omicron surge just back to back, but there were so many other cases that they had to cancel or postpone. So it's going to take some time to recover. And so what we really need to do is keep the number of cases down as long as we can, and really hold off the next wave of cases for as long as we can, so that hospitals do have a chance to recover.
The other long-term impact that we're seeing beyond needing to keep this thing at bay as these variants come along are what they call the long-haul COVID patients. We still don't know very much at all. I don't think we can generalize yet about who's likely to have the long-term problems, but give me your thoughts about what you've seen so far about long-haul.
I think it's very true that we don't have the ability to predict who's going to have long-term symptoms and who won't. What we actually saw is that people who've had relatively mild disease can end up with long-haul COVID. And again, our understanding about the long-term consequences of infection, we're still learning. We don't know how this will affect people 5 years post-infection or 10 years post-infection. So we're still really figuring out what some of the long-term consequences could be. And this is one of the reasons why getting vaccinated is so important. We know that vaccines don't stick around in your body for very long. It's just a little messenger that tells your immune system how to respond. And so the long-term consequences of vaccines have been well studied and well elucidated. But what we're really concerned about would be long-term consequences of COVID infection, for which we really don't know.
Yeah, and we're still fighting the long-term impacts of misinformation. It's just what you're saying about the vaccine. I still see emails about that on a weekly basis. Doctor, thank you so much for your thoughts and your time, and we'll talk to you again soon on the program.
Thanks for having me on.
You bet. The state's Chief Medical Officer, Dr. Natasha Bagdasarian.